I'm thankful for my volunteers because they dedicated a day off, a day that they're not getting paid, to come out here and serve the community, to live the mission of St. Vincent's, to bring St. Vincent's name out into this community, and to establish those connections where we support those who are poor and vulnerable and most in need.
And what I was amazed at is the number of young people that they were able to recruit and to contribute back here. They have the nursing students, the medical students, all of them that have come into this career because they want to be giving themselves to the community and to the patients. It felt really good. This is definitely healthcare that leaves no one behind.
It is about, providing for the poor and the needy. Look back to our history. St. Vincent's was founded back in 1903 by the Daughters of Charity. We're here 112 years later, and we are here in the community.
As we opened the doors, we had greeters there. And as people were waiting, they were able to talk to them and, kind of get used to being in the environment.
You see people from all ethnic groups, you see people from all races, just talking. We're all here for the common mission, we're all here for the common good.
Was robbed and stabbed a couple times, actually 3 times, in my stomach, my arm, and up here in my shoulder, so I lost my job. And then with that, pretty much started using and stayed at that apartment as long as I could, and I got evicted. And when I got evicted, I was staying on the streets for a little bit.
Ben was a very cool guy. He seemed like a completely normal guy. I think if you were just to see him walking down the street, you wouldn't really have an idea of what he's been through, and he's taking the steps to pick himself up and to get himself back on track.
I want what I lost again. I can't do what I used to do. For me to be a roofer at my age, it's very physically intense. This last 60 days was a fight. And, in my mind, I didn't do that for nothing. I won't let that be for nothing. I used alcohol, as like a self-medication for a lot of issues for a long time. And I finally got to the point where I was ready to acknowledge my problems and get real help, not just keep, drinking my way through it, because it wasn't working. It's unfortunate, there's a lot of people that, are homeless and that have problems. And, when you get to that point, it's difficult to take the right path because you're just so unhappy.
I'm going to take your blood pressure, okay? Welcome to St. Vincent's Medical Mission.
So the first thing that would happen was their vital signs would be taken. So there was a whole group of nurses there saying, welcome, let me have you sit down, let me talk about why you're here today. Let's take a little check on your blood pressure and make them feel comfortable.
Because remember, not only do we want to keep your son healthy, we want you to be healthy as well. So remember that we can also take care of you while you're here today.
And then they would go meet their physician and have their physical exam.
I got 3 herniated discs, sciatica, a degenerative disc disease, I guess they call it. I need to get a primary care doctor established because I'm new to Bridgeport. The fact that he's willing to, get me in, fit me into the schedule, get me an actual appointment. I can't tell you how great that is. I mean, it really is. It's a huge load off. Here he is putting in his time and immediately able to address some things. That's more than I ever expected when I walked through the door today.
Person can sick and don't know it. You understand? And coming for a coat drive and end up into a event like this, it's amazing to me. My blood pressure has been taken, my vitamins are taken.
Here we can screen them for, things like diabetes, cholesterol, blood pressure, basic things, but it can make a huge difference in the long run.
And that's, it's important. You want to make sure that once they get this kind of care, if they need follow-up, if they got a prescription and they're going to need some follow-up care, that we connected them to local physicians. And then they were offered to have vaccinations. There were other types of tests that could be taken in the gym. I saw a lot of people learning how to stop smoking, which was really important.
Because Marcel was telling me he was a little hungry.
Me too.
Yeah, so you can both have some lunch. Mm-hmm. Okay.
And then they had an opportunity to go into the cafeteria and have a good hearty lunch. And that, for some people, they don't get to do that every day. we decided that we were going to make sure that people had reader eyeglasses. And we just laid them out and gave people an opportunity to go choose the ones that made sense to them, that they could use to read.
You also have to take care of your needs, from a mental health perspective. And so we've found a lot of people who have just recently moved here and they don't know anybody, they don't have any providers, they don't know anything about the community. And so we've been able to sit and talk to them and provide community resources.
There was also a pharmacy center which provided 30-day supply of pharmaceutical products with the objective that whoever gets a prescription will go see a doctor in 30 days.
We also were able to have our pharmacists sit down with people who had prescriptions and say, what are you taking? Should you be taking that? Do those things go together? Are they going to be in conflict? Foot washing, so that was a combination, right? Foot washing is the ritual, the cleansing ritual. And so there was the spiritual side of foot washing, and there also the ability for our parish nurses, who were the ones who did the foot washing, to actually look to see whether or not there was a reason for people to be concerned about something having, something on their foot, if they're diabetic, etc. So they were able to do the ritual washing and also give them advice about taking care of their feet. And if they needed to be referred to a podiatrist, we had the podiatrist there.
After people had the foot washing, they would come over and see if they could find a pair of shoes to take with them. It was awesome to see the smiles and how wonderful they felt.
I stopped by the foot washing area, and a gentleman was walking out, and he was smiling, he was high stepping, he was showing off his new shoes. He was touched, and it wasn't an emotional crying. It was a jubilant, thank you, smiling. Thanks for being here. He's thanking everybody out, high fives on the way out of the room. That's that little thing. We've changed his life today.
We had, I don't know, maybe 500 coats. Plus we had socks and scarves and hats, and we had children's clothing as well, all donated by Project Homeless Connect. And that was a big hit. And people, again, they need to make sure that they have clean, warm coats for the winter. And we had those today. So once that navigator was assigned and they took that patient through all the different places that they could receive service, I know that relationships were formed because I watched them. I saw them having lunch in the cafeteria. I saw them walking and holding their bags and making sure that they got every service that they needed to get.
So you know what? Sometimes we need to step out of our norm, come out here. That is very different than what you normally see in our normal daily professional lives. That difference changes who we are and changes who they are.
I am overjoyed. I feel blessed. I feel like, we mobilized the St. Vincent's community today in a really special way. And I could see walking around the faces of the nurses and the physicians and the volunteers and the navigators. They were really doing something special.
It's been an absolutely amazing day. I found people who came in here for services marveled by how smooth it was, the logistics. I found a staff who was invigorated, energized, and many of our staff came up and said, this is exactly what we needed. Reminded us of why we went into medicine in the first place.
We can make a difference. Seeing the experiences in the patients and the looks on their faces, that's life-changing. I don't care if you've been doing it for 40 years or you're still going to school to learn how to do it. That makes that connection. That's what healthcare, that's what community service, and that's what St. Vincent's is about.
And it really allows you to bring home the way you feel about your own community, and to really get your colleagues and the people who you work with every day to feel something a little bit deeper.
Not only do we change the lives of those that we serve, we change the lives of our students, and I think we change the lives of many of our staff.
I came here not thinking I could make much of a difference, and it turns out I am.
It's just a beautiful feeling to know, like, okay, I could come here and they're gonna help me. And I'm asking for help. And I know that you love us because for what you're doing today. And not even knowing us,